The benefits and risks of receiving an epidural during labor. The most common form of pain relief that a woman has during labor is an epidural. It's important to understand what the benefits and risks of an epidural are, so that way you can decide if it's a good option for you and your birth plan. So there's some great benefits to receiving an epidural. First of all, pain relief. As we all know, labor is not easy. Contractions can be hard, uncomfortable, and painful. And it's hard. Labor is hard work. And it's understandable to not want to experience that any longer. And so an epidural gives you the opportunity to have quick pain relief, so that way you can then proceed to enjoy the labor that you're having, which is another benefit of receiving an epidural, is that you get to enjoy the experience and be very present in the experience. A lot of women who have unmedicated labors, they don't really remember much of it, simply because it's almost just survival getting through labor. And so having the epidural allows you just to be calm and present through the entire experience, just to enjoy that little bit of time that you have left before baby arrives. And it can just make the experience seem that much more satisfactory because of it. It also gives women the opportunity to sleep and rest before baby arrives. Labor is an exhausting process, and so having the opportunity to sleep before you won't be sleeping very much anymore is a great option, and something that is very positive about receiving the epidural. On the opposite side of things, there are some risks involved. One is your blood pressure can drop. This is one of the biggest reasons why they administer a bag of IV fluids prior to you receiving an epidural. By receiving these fluids, it reduces your risk of having that blood pressure drops, but it is still a risk that can occur. It's very common for you to have your blood pressure monitored much more frequently with an epidural than without. Typically, throughout the hour, you're going to have your blood pressure taken. Another, downfall or risk to having an epidural is that you are now confined to the bed. You're going to be limited to your motion, which some women are a little disappointed about. They would like the opportunity to get up and walk around and be able to move, so you will be confined to the bed from that point forward, since you are numb from the waist down and it's not safe for you to be walking and moving around. You are able to lay down, sit up, go from side to side in the bed. That's about as far as you can be able to go with that. Some women also can have headaches after receiving an epidural. They may have trouble pushing and require some coaching during pushing because you're numb and aren't feeling those contractions. It's hard to push with that urge and know how strongly to push, and so it's very common with an epidural to have kind of that coached pushing where the nurses will say go and count down to, count to 10, take a deep breath, and you repeat that about 3 times. There are some possible lasting effects with an epidural. You can have pain at the injection site, you can have headaches, you can just have backaches, and possibility of nerve damage is a very small possibility, but there are some things that can last beyond birth into your postpartum period. There are also some occurrences where the baby may have trouble with the epidural. There might be some heart rate changes, some decels in their heart rate that could be concerning, and so you will be continuously monitored from that point forward to make sure that baby is tolerating the epidural